Hello, everyone. Did you know that the sixth week can reveal some of the most important signs about your baby's development? This is a critical period when certain behaviors are expected, routines begin to form, and some warning signs should never be ignored. Today, we will talk about what happens during your baby's sixth week, which situations are considered normal, and which symptoms require an immediate visit to the doctor. We will also cover vaccination status, developmental monitoring, feeding, colic, sleep routines, and very important warnings for mothers. According to the Ministry of Health vaccination schedule, there is no routine vaccine administered during the sixth week. However, there is an important point parents should be aware of. From the sixth week onward, there are certain vaccines recommended by the Ministry of Health that have not yet been included in the routine immunization program. The most important of these are meningitis vaccines and the rotavirus vaccine. Because these illnesses can lead to serious and life-threatening consequences, there is a limited time window to administer these vaccines. If you are considering them, it is very important not to delay. As mentioned before, your baby was examined by a family physician during the first month. During these routine checkups, the following measurements are taken: height, weight, and head circumference. In most cases, these visits are uneventful. However, especially around the sixth week, if you notice unusual growth, very rapid development, or insufficient growth in weight, length, or head circumference, further medical evaluation is strongly recommended. By the sixth week, your baby begins to socialize in a more meaningful way. They can now truly see you, recognize you, and respond to you. The social smile that appears during this period is not a reflex. Your baby smiles when seeing you, hearing your voice, or responding to something pleasant. This is one of the most anticipated and unforgettable moments for parents. Babies who reach 6 weeks of age usually feed more efficiently and consume breast milk more quickly. Sometimes they feed so fast that they may still appear hungry. This can lead to nighttime fussiness. There can be many reasons for this, including hunger, colic, gas, room temperature, overstimulation, or illness. If your baby wakes early at night, wants to feed frequently, and appears unsettled, a small trial of formula may be considered. If the baby relaxes afterward, hunger is often the cause. It is important to remember that colic is not just gas pain. The type of nutrition a baby receives, breast milk, formula, or changes in feeding, can cause discomfort and contribute to colic. A detailed video about colic is also available on the channel. Even at 6 weeks of age, if your baby does not smile when seeing you, does not respond to sounds, has difficulty following objects, or cannot lift their head during tummy time, you should seek medical attention without delay. Tummy time is especially important during this period. It helps strengthen the baby's neck and back muscles and supports overall motor development. At this stage, brightly colored, high contrast, and movement-based toys can be used. However, an important safety warning must be emphasized. Plush toys should never be left with the baby during sleep, as this may increase the risk of sudden infant death syndrome. They can be used during playtime but should always be removed from the sleep environment. Babies can become easily bored during this stage, and often express this through crying or restlessness. Short outdoor walks can be very beneficial. However, Outdoor time does not mean shopping malls or crowded and polluted environments. Instead, green, clean, quiet, and shaded areas should be preferred. These environments allow your baby to observe their surroundings and support cognitive development. Toward the end of the second month, babies gradually begin to establish a day-night rhythm. During this period, creating a consistent sleep routine is very important. This may include bath time, gentle massage, and a calm, quiet environment. Once a routine is established, it should be maintained as consistently as possible. During the postpartum period, mothers commonly experience vitamin deficiencies, physical exhaustion, and emotional fluctuations. If symptoms such as lack of motivation, low mood, or loss of enjoyment in daily life persist for more than 1 month, this may indicate postpartum depression. In such cases, seeking professional help is very important. Your baby is now communicating with you more clearly. Smiles, eye contact, and responses increase every day, and this stage passes very quickly. Take photos and videos, and create memories. See you in the 7th week video. Goodbye.